Okay, so today we're diving into something I think a lot of people struggle with, and I bet you know exactly what I'm talking about. Those pesky recurrent respiratory infections, RIs,
Yeah. Yeah, those things.
the endless cycle of coughs and sniffles and sore throats and, just feeling crummy. We've got a really interesting mix of sources you've sent us. We've got some hardcore medical research, some expert opinions, even some pretty practical advice that I'm actually kind of excited to get into. So basically, we want to help you really understand what all this tells us about how to manage these infections, maybe even, make them a little less frequent in your life.
Yeah, exactly. And you've been dealing with this, and I'm sure you don't want to get bogged down in a bunch of medical mumbo jumbo, right?
Yeah.
So what we're really trying to do today is look at all of this material you sent and figure out what are the most useful, actionable things you can actually take away from this about recurrent respiratory infections.
Okay, so to start off, let's make sure we're all on the same page about what exactly we mean when we say recurrent, right? Like, how often do we have to be sick to officially qualify as recurrent?
Right, right.
Luckily, one of your sources actually spells it out pretty clearly.
Okay.
Recurrent respiratory infections in children. This one gives us some pretty specific benchmarks, at least when it comes to kids. They talk about things like having 6 or more respiratory infections every single year, or more than one infection per month, specifically in the upper airways, from September to April. They even mention 3 or more lower respiratory infections per year. But what's interesting is they also point out that these definitions, they can be kind of arbitrary.
Oh, that is interesting because I think a lot of people get really hung up on oh, I was sick this many times, so it must be this. You know what I mean?
Right,
It's
exactly.
more of a, more fluid than that.
Yeah, it's not just about counting the number of times you get sick,
Yeah.
right? Especially with kids.
Right.
Because their immune systems are still developing, they're going to get sick more often, especially when they start, interacting with other kids more.
Oh,
It's kind of
that's
just part of the process.
yeah.
And actually, that same source, recurrent respiratory infections in children, makes a distinction between what they call physiological respiratory issues, which is kind of like the normal amount of sickness you'd expect, especially in the fall and winter. They say for younger kids, that might be like 6 to 8 episodes, and then for older kids, 2 to 4. So it's not necessarily a cause for alarm if your kid is getting sick a few times a year.
Right. Right. You don't want to jump to conclusions immediately.
Exactly.
Yeah.
Exactly. But you also don't want to completely ignore it. Right.
Right.
Because these recurrent infections, they can actually have a real impact, not just on your health, but also on your wallet.
Oh, yeah, for sure.
The abstract from the Global Initiative for Chronic Obstructive Lung Disease, GOLD guidelines, and that recurrent infections of upper and lower respiratory tract article, they both talk about the economic burden of all this sickness.
Oh, yeah. No, I can see that.
Think about all the days you have to take off work, or your kid has to miss school, and all the doctor's visits and medications and stuff.
Yeah,
It all
absolutely.
adds up, and it can definitely impact your quality of life, too, Just feeling constantly run down and sick, it can be really draining.
Oh, yeah, for sure. And I think for someone like you dealing with this constantly, that economic impact and that quality of life hit is probably something that you feel very personally and you're really familiar with.
Yeah, for sure. So now that we know what we're talking about with recurrent respiratory infections,
Hmm.
and we understand how much they can impact us, let's figure out why they happen in the first place, right?
Yeah, let's get down to it.
Like what makes some people more likely to get these infections over and over. And again, recurrent respiratory infections in children has a lot of great information on this. It kind of makes sense. But one of the biggest factors is simply that young children's immune systems are still developing.
Yeah, that makes sense.
They're still learning how to fight off all these different bugs, and so they're just naturally more vulnerable.
Right.
But it's not just about age, right? Because even adults can get recurrent infections, so what else is going on? Well, obviously, the more you're exposed to these viruses and bacteria, the more likely you are to get sick.
Oh, yeah.
And that's where early socialization comes in.
Oh, interesting.
That source points out that up to 25% of babies under 1 year old and almost 20% of kids between 1 and 4, they experience these recurrent infections. And get this, something like 70% of children with RRI, they're in daycare.
Wow, that is a big percentage.
So that close contact with other kids, it really does make a difference.
Yeah, it's almost like a constant exchange of germs.
Oh, for sure, for sure.
Especially if they're not all washing their hands and covering their coughs and stuff.
Right.
So I guess you could say being around other children, especially in close quarters like daycare, is a big risk factor.
Yeah, it's definitely something to keep in mind.
Yeah.
But it's not just about being around other kids, right? The environment you're in, that can play a huge role too.
Oh, okay.
That same source, recurrent respiratory infections in children, highlights a few key environmental factors. For example, exposure to tobacco smoke. That's a big one.
Oh, okay.
And they point out that the more you're exposed to smoke, the higher your risk of infection. It's not just about you smoking either.
Right.
Even if your mom smoked while she was pregnant with you, that could have an impact.
Wow, I didn't know that.
Yeah, it's pretty crazy.
Uh-huh.
And then, of course, there's just general environmental pollution, both indoors and outdoors. Indoors, you've got things like dampness and mold, which can really affect your respiratory health.
Right, yeah.
And outdoors, there are pollutants like sulfur dioxide and nitrogen dioxide.
Oh, yeah, heard of those.
All of these can increase your susceptibility to infections.
Makes sense. And then there's the whole breastfeeding thing.
Oh, right. Yeah.
We know that breast milk is packed with antibodies and all sorts of good stuff that helps boost a baby's immune system.
Mm-hmm.
So if a baby isn't breastfed, or if breastfeeding is stopped early, that can also increase their risk of getting sick more often.
So it's not just about what you're breathing, but also what you're eating, or in this case, drinking, that can have a big impact.
Exactly. And even your family situation can play a role. Like if you have a large family and you're all living in close quarters, there's just more opportunity for germs to spread around.
Oh, yeah, no, that's true.
And if there's a family history of atopic diseases like asthma or eczema, that can also increase your chances of getting recurrent infections.
Oh, interesting.
So it's really a whole mix of factors that come together.
Right.
And then, on top of all of that, there are some individual factors that can play a role too, like being born prematurely or having a low birth weight or even just being male.
Oh, really? I wonder why that is. Yeah, me too. It's interesting. The source also mentions intense physical stress as a potential factor, so athletes and kids who start swimming really early in life might be more susceptible.
Huh. You learn something new every day.
And of course, making sure your vaccinations are up to date is super important for protecting against certain infections.
Absolutely. Vaccines are crucial.
And they even mention gastroesophageal reflux as a possible contributing factor.
Oh, wow. I wouldn't have thought of that.
Yeah, it's really quite a comprehensive overview of all the things that can make you more susceptible to these infections.
Yeah, it sounds like there's a lot to consider.
For sure. But then there's another thing to keep in mind, which is that sometimes these repeated infections, they might actually be a sign of a more serious underlying medical condition.
Oh, that's right.
So how do you know when it's just a string of bad luck and when it's maybe something more?
Yeah, that's a really good question because I think sometimes it's easy to just brush it off as like, oh, I'm just prone to getting sick.
Exactly. But you don't want to miss something important, right? So that recurrent respiratory infections in children's source, it actually gives us some specific warning signs to watch out for. These are things that might suggest there's a deeper issue going on, like maybe an immunodeficiency or cystic fibrosis or even a congenital anomaly.
Okay, so what are some of those red flags?
Well, if your child has 8 or more ear infections in a year, or 2 or more serious sinus infections, or 2 or more bouts of pneumonia within a 12-month period, those are definitely reasons to get them checked out by a doctor.
Okay, that makes sense. Those sound pretty serious.
Yeah, for sure.
Yeah.
And then there are other things like invasive infections, failure to thrive in children, recurrent abscesses, persistent thrush, a poor response to antibiotics, needing intravenous antibiotics to clear an infection, and a family history of primary immunodeficiency.
Wow, that's quite a list.
It is, but it's important to be aware of these things,
Oh,
right?
okay.
Because if any of these warning signs are present, it's crucial to consult with a healthcare professional to rule out any more serious underlying conditions.
Right, it's better be safe than sorry.
Exactly. Okay, so now that we have a better understanding of what causes these recurrent infections, let's talk about what we can actually do about them, right?
Yeah, let's get to the good stuff.
Both in terms of preventing them and treating them when they do happen.
Okay,
Your sources offer a pretty wide range of strategies, and we're going to cover them all.
great.
So first up, let's talk about some of the general measures that are highlighted in both and that Golden Solution article you sent.
Okay.
It probably won't surprise you that a lot of it comes down to the basics, like taking care of your overall health.
Oh, I see.
You know, making sure you're eating a healthy diet, getting enough sleep, and exercising regularly.
Yeah, makes sense.
These things are super important for supporting your immune system and making it as strong as possible.
Absolutely. Those are like the
Well,
foundation, right?
right.
You have to build on a strong foundation.
Yeah, for sure. And then in terms of preventing infection in the first place, the Golden Solution article, it really stresses the importance of good hygiene.
Oh, okay.
Washing your hands frequently and thoroughly, avoiding close contact with people who are sick, and making sure there's good ventilation in your home and workplace.
Yeah, that makes sense.
These are all simple things, but they can actually make a big difference in reducing your exposure to germs.
Right. It's all about minimizing those opportunities for infection.
Exactly. Now, when it comes to medical treatments, AG mentions things like antibiotics and antivirals, but it's really important to emphasize that you should only use these medications under the guidance of a medical professional.
Oh, absolutely, yes.
They also talk about bronchodilators for people who need them, and of course, staying up to date with your vaccinations, like getting your annual flu shot and the pneumococcal vaccine.
Right, those are all important for preventing specific infections.
Exactly. And if you have any chronic health conditions like asthma or diabetes, managing those effectively is also key to minimizing your risk of respiratory infections.
Yeah, for sure. If you have any underlying health issues, those can make you more vulnerable to infections in general.
Exactly. Okay, so those are kind of the standard medical approaches, but the Golden Solution article, it actually introduces some more, let's say, unconventional methods.
Oh, okay, like what?
They focus on honey and fasting.
Honey and fasting, that's interesting.
Yeah, I thought so too. So let's talk about honey first.
Okay.
There is some limited research suggesting that honey might be helpful for coughs, but the evidence for it actually preventing or shortening upper respiratory infections, that's not quite as strong.
Ah,
And it's important to remember that honey is not safe for everyone. Babies under 1 year old shouldn't have it because of the risk of botulism. And if you have diabetes or allergies, you should definitely talk to your doctor before using honey.
right. It's not a one-size-fits-all solution.
Exactly. Now, the Golden Solution article highlights the specific method developed by Dr. Hassan alwarraqi, where you rinse your mouth and nose with honey at least 5 times a day.
Oh, wow.
Yeah, it's pretty interesting. He claims that this can help with all sorts of respiratory issues, headaches, sinus problems, the whole works.
Huh. I never heard of that before.
Yeah, it's definitely not your typical remedy. And the article goes into detail about the 5 different stages of this cleansing process. You start with your mouth and teeth, then you move to the skin around your nose and sinuses, and you even gargle with honey.
Wow, that's pretty intense.
It is. But while this article presents it as a potential solution, we do want to be clear that the scientific evidence supporting it, especially for preventing recurrent infections, it's not as strong as some of the other strategies we're going to discuss. Okay, so then we have fasting.
Oh, right, fasting.
The article talks about both intermittent fasting, where you have like a 16 to 18-hour eating window each day, and Islamic fasting, where you abstain from food and drink from dawn till dusk.
Okay.
And they suggest that fasting could potentially support your immune function and reduce inflammation in the body.
Huh, that's interesting. I've heard about some of the potential benefits of fasting, but I didn't know it could be linked to immune function.
Yeah, it's definitely an area of ongoing research.
Right.
But again, the article is very clear that more research is needed, and fasting is not suitable for everyone.
Of course, yeah.
Pregnant or breastfeeding women and children shouldn't fast, and people with certain medical conditions need to consult with their doctor before trying any kind of fasting regimen.
Yeah, it's definitely not something to jump into without doing your research and talking to a healthcare professional.
For sure. Okay, so now let's shift gears a bit and talk about a category of preventative strategies that gets a lot of attention in your sources, especially in recurrent respiratory infections in children and recurrent infections of upper and lower respiratory tract.
Okay, what's that?
Immunomodulating agents.
Immunomodulating agents, what are those?
Basically, they're substances that can help to influence or support your immune system.
Oh, okay, so like boosting your immune system.
Yeah, kind of. It's more about modulating or fine-tuning its response rather than just boosting it in a general way.
Interesting. So how do they work?
Well, there are actually a lot of different types of immunomodulating agents, and they all work in slightly different ways.
Okay.
But the idea is that they can help to train your immune system to be more effective at fighting off infections.
Okay, that makes sense.
And your sources go into a lot of detail about several specific agents. So let's start with bacterial extracts, specifically one called OM85.
OM85.
Yeah.
I've never heard of that.
They highlight this one as being the most extensively studied immunomodulating agent out there.
Oh, wow. Okay.
So what is it?
Yeah, tell me more.
Basically, it's a lysate, which means it contains broken down components of 21 different strains of bacteria.
Okay.
And these are all common bacteria that are often involved in respiratory tract infections.
Oh, I see. So it's kind of like exposing your immune system to loaded to the bad guys so it can learn how to fight them off better?
Exactly. It's like a training exercise for your immune system.
That's a great analogy.
And what's really cool is that it seems to work on both the innate immune system, which is your body's first line of defense, and the adaptive immune system, which learns and remembers specific threats over time.
Oh, wow. So it's kind of a two-pronged approach.
Exactly.
Yeah.
And it even helps these special immune cells called dendritic cells to mature in these areas of your gut called Peyer's patches.
Peyer's patches.
Yeah. They're basically like little immune system training grounds in your gut.
Huh. Interesting.
So OM85 is kind of helping to train your immune system on multiple levels.
That's pretty amazing.
And the research on it is actually really promising.
Oh, really?
Yeah, there have been several studies showing that it can reduce the number of recurrent respiratory infections in both adults and children.
Wow, that's great news.
Yeah, and they've seen reductions in the frequency and duration of infections, a decreased need for antibiotics, fewer days missed from school or work, and even a reduction in episodes of wheezing.
That's incredible. So for someone like you dealing with these recurring infections, the fact that OM85 can actually train your immune system to fight them off better, that's got to be pretty significant.
Yeah, absolutely. And there was this Delphi study mentioned in one of your sources that showed a consensus among experts about both the effectiveness and the safety of OM85.
Oh, wow. So the experts agree on this one.
Yeah, which is always reassuring.
Definitely.
And what's especially relevant these days is that OM85 might also help to improve your immune response against recurrent viral infections.
Oh, wow. That's really important.
Yeah, and there's a general agreement that combining OM85 with the flu vaccine in children, that's both safe and effective for boosting their protection.
So it's like a 1-2 punch against those pesky viruses.
Exactly. Okay, so moving on, we've also got these biologically active polysaccharides, or glucans.
Glucans.
Yeah, what are those? They're naturally occurring polysaccharides that are found in the cell walls of fungi, plants, and some bacteria.
Okay.
And they basically work by activating immune cells and influencing the production of these signaling molecules called cytokines, which are basically how your immune cells communicate with each other.
Oh, so they're like little messengers that tell your immune system what to do.
Yeah, exactly.
That's cool.
And some specific types of glucans, like immunogluten, schizophilin, and lentinin, they've been shown to be particularly effective at modulating the immune response.
Okay, so what kind of effects do they have?
Well, they can do a lot of things. They can increase the activity of various immune cells, promote the growth of lymphocytes, which are a type of white blood cell, increase the production of this important antibody called secretory IgA, enhance phagocytosis, which is the process by which immune cells engulf and destroy pathogens, boost the activity of natural killer cells, support the maturation of those dendritic cells we talked about earlier, and influence the release of cytokines, helping to balance the Th1 and Th2 arms of the immune response.
Wow, that's a lot.
It is. It's like they're giving your immune system a whole tune-up.
Right.
And there's even a study mentioned that showed a decrease in enlarged adenoids and a reduction in the frequency of recurrent upper respiratory infections in children who were given glucans.
So they seem to be pretty effective.
Yeah, they definitely show promise. Now, another interesting approach is systemic enzyme therapy, or SET-T.
Systemic enzyme therapy. That sounds pretty intense.
It does, but it's actually quite simple.
Oh, okay.
Basically, you take specific combinations of enzymes orally, and the idea is that these enzymes can help to modulate your immune function, reduce inflammation, and even break down blood clots.
Oh.
Your sources suggest that SET might be a helpful add-on treatment for allergies and asthma, and it might even reduce the need for corticosteroids.
Oh, that would be great. Corticosteroids can have some pretty nasty side effects.
Yeah, they can. And there's actually research to support the use of SET-TET for recurrent respiratory infections.
Oh, really?
Yeah, one study compared SET using a product called Wobenzym to bacterial immunomodulators, and they found that both groups had a significant decrease in inflammation and a reduced need for antibiotics.
Wow, so they were both equally effective.
Yeah, it seems so. And the sources also mentioned that SET might be helpful for other conditions like sinusitis, tonsillitis, laryngitis, chronic secretory otitis media, and even in normalizing elevated IgE levels, which are associated with allergies.
So it's kind of a multi-purpose tool.
Yeah, it seems to have a lot of potential applications. Now, your sources also briefly touch on a whole bunch of other immunomodulating agents, but the evidence for their effectiveness in preventing recurrent respiratory infections, at least in people with healthy immune systems, it's not quite as strong.
Okay, so what are some of those?
They mention things like isoprenosine, transfer factors, thymus hormones, and then a variety of vitamins and minerals like vitamin C, D, zinc, and A.
Right, I've heard of some of those.
Yeah, but the research findings for those can be a bit mixed.
Ah.
They also talk about prebiotics, probiotics, and nucleotides, which might have some benefits, but the results for preventing recurrent infections specifically, they're not always consistent.
So it's kind of a mixed bag.
Yeah, pretty much. And they even mention some popular natural remedies like echinacea, ginseng, astragalus, viscum album, and propolis.
Oh, right. Those are all pretty common.
They are, but again, the research is mixed, and some of them can have side effects like skin rashes or allergic reactions.
Yeah, it's important to be aware of that.
Yeah, for sure. So it's always a good idea to do your research and talk to your doctor before trying any new supplements or remedies, especially if you have any underlying health conditions.
Absolutely. It's better to be safe than sorry.
Exactly. Okay, so last but not least, the recurrent respiratory infections in children source, it really emphasizes the importance of follow-up care and providing education to parents and caregivers.
Oh, that's really important.
It is. One of the key messages is just reassurance. A lot of times, these recurrent infections in kids, they're just a normal part of growing up and they're temporary.
You're right.
So it's important for parents not to freak out, you know?
Yeah, I can imagine it can be really stressful for parents when their kids are constantly getting sick.
Oh, absolutely. But the source also stresses the importance of environmental preventative measures.
Ooh.
Things like reducing daycare attendance if possible, completely eliminating smoking in the household, and making sure that daycare environments are well ventilated and have high hygiene standards.
Right, so it's about minimizing exposure to germs as much as possible.
Exactly. And they strongly advise against using prophylactic antibiotics routinely because that can contribute to antibiotic resistance.
Yeah, that's a big problem.
It is. But they do mention that in certain specific cases, surgery like adenoidectomy or tonsillectomy might be an option, but only after careful consideration and based on established medical guidelines.
Okay, so it's not a first-line treatment.
Right. The main takeaway is that we should avoid overly aggressive interventions, especially in children whose immune systems are developing normally.
Makes sense.
Okay, so to sum it all up, recurrent respiratory infections, they're super common, especially in young kids, and they can be caused by a whole bunch of different factors. And while those general health recommendations like eating well, sleeping enough, and practicing good hygiene are definitely important, your sources also highlight some really promising preventative and treatment strategies, particularly in the area of immunomodulation.
Yeah, like that OM85 we talked about.
Exactly. And those other agents like glucans and systemic enzymes, they all seem to have a lot of potential for helping people who are prone to these infections.
Right. It's not just about treating the symptoms anymore. It's about actually addressing the underlying issue.
Exactly. And even though the research on honey and fasting for preventing recurrent infections isn't quite as robust yet, there's still interesting areas to explore.
Yeah, for sure.
So out of everything we've talked about today, what stands out to you as being the most significant takeaway?
That's a good question. I think for me, it's the increasing evidence supporting the use of targeted immunomodulation. Like the idea that we can actually help to train and support the immune system to be more effective at fighting off infections, especially in people who are prone to getting sick repeatedly. That's really exciting.
Yeah, I agree. It feels like a much more proactive approach than just waiting for infections to happen and then treating them.
Right.
And, it makes me wonder, what do you think the next big breakthrough in this field will be?
Oh, that's a tough question.
It is. But given how complex the immune system is and how differently people respond to infections, there's still so much we don't know.
Yeah, that's true. But research is constantly evolving, and new discoveries are being made all the time.
Exactly. And that's why it's so important to stay informed and to be open to exploring new approaches.
Absolutely.
So thank you so much for joining us for this deep dive. And thank you to our listener for sharing your sources and for trusting us to explore this topic with you.
Yes, thank you. We hope this is giving you some valuable insights and some new things to think about.
And who knows, maybe you'll be the one to make the next big breakthrough in understanding and preventing recurrent respiratory illnesses.
That would be amazing.
It would. So keep learning, keep asking questions, and keep taking care of yourself.
And stay healthy.
Yes, definitely stay healthy.